I would like to call this meeting to order. Welcome everyone to Assembly Legislative Operations and Elections. I'm welcoming everyone that is watching online or participating through Zoom. With that, I would like, please, Madam Secretary, please take the roll.
Assemblywoman Dickman.
Here.
Assemblyman Frierson. Assemblywoman Gonzalez.
Here.
Assemblywoman Howdegi.
Here.
Assemblyman Levitt.
Here.
Assemblyman Matthews.
Here.
Assemblyman MacArthur.
Here.
Assemblywoman Monroe Moreno.
Here.
Assemblywoman Thomas.
Here.
Assemblywoman Torres.
Here.
Chair Miller.
Here. And with that, will you please mark Speaker Frierson absent excused? Just a few reminders, we will have public comment, up to 30 minutes of public comment at the end of the agenda. And anyone interested in making public comment on anything that falls under the purview of this committee is welcome to do so by registering on the agenda. Once the agenda is posted, there's a link provided to you so that you can register to do so. We have, today we have two items on our agenda where we will begin with a work session and then we will move into a bill hearing. So I'm actually, first thing I'd like to do is to open the work session on Assembly Bill 1. Also, Ms. Lyons is not here with us today, so Mr. Sturm is actually filling in and covering for her. And one more thing, we weren't able, the work session documents were not delivered, but they are available on Nellis if you'd like to sign in and pull them. And with that, Mr. Sturm.
Thank you, Madam Chair. For the record, I'm Pepper Sturm. I'm a principal policy analyst with the research division. And the work session document for the bill is uploaded to Nellis for those listening in. And the bill before you today is Assembly Bill 1. It was first heard by the committee on February 18th. Basically, Assembly Bill 1 revises the training required for newly elected legislators to also include a discussion of local governments in Nevada. The discussion must include overviews of the structure and authority of local governments, their financial administration, and the services provided by local governments. And there were no amendments proposed for this bill. Thank you, Madam Chair.
Thank you, Mr. Sturm. Members of the committee, are there any questions?
No questions, Madam Chair. I make a motion to do pass.
Sure, thank you. I will accept that motion, Vice Chair Howdegi.
I will second the motion. This
Was
is
it your-
Assemblywoman Monroe Moreno. I will second the motion.
Perfect, thank you. I have a motion by Vice Chair Howdegi and a second by Assemblywoman Danielle Monroe Moreno. I might as well finish it if I started it. With that, are there any comments or questions on the motions? Not seeing none. Committee Secretary, will you please take the roll call vote?
Assemblywoman Dickman.
Yes.
Assemblywoman Gonzalez.
Yes.
Assemblywoman Howdegi.
Yes.
Assemblyman Levitt.
Yes.
Assemblyman Matthews.
Yes.
Assemblyman MacArthur.
Yes.
Assemblywoman Monroe Moreno.
Yes.
Assemblywoman Thomas.
Yes.
Assemblywoman Torres.
Yes.
Chair Miller.
Yes. And with that, the motion passes. And I would like to assign the floor statement to Assemblywoman Dickman.
Thank you, Madam Chair. Appreciate it.
You're welcome. Thank you. So now I will move on to our next agenda item and open the hearing on ACR 5. ACR 5 is sponsored by Assemblywoman Anderson And she has some co-presenters with her, Dr. Hunt, Dr. Packman, and former Assemblywoman Connie Monk. The measure that they will be presenting directs the Legislative Commission to appoint an interim committee to study the behavioral health workforce in the state of Nevada. With that, Assemblywoman, we are ready whenever you are.
Thank you, Chair Miller, Vice Chair Harrigy, and members of the Legislative Operations Committee. Good afternoon. My name is Napa Anderson, and it is my honor to represent Assembly District 30. I also have today the pleasure of presenting ACR 5 to all of you. I wanted to just to share a few very quick items before actually handing it over to my co-presenters today. The first, I personally believe, and I know that many others do, mental health is just as important as physical health. This philosophy is easily seen in numerous studies, both around our state, around our counties, and also around our nation. When I started to prepare for this bill, I was just, the number of different studies that are out there, it becomes overwhelming. And it's very clear that the importance of mental health is something that we all can see, but the number of people entering the profession is not what it needs to be. And that's why this bill is only about the number of people entering this profession. I looked at the 2014 Gwynn Center report, which I believe has been uploaded as an exhibit, as kind of a baseline for our state, because it does allow for some different recommendations that we are working on. But the hardest thing is finding the data that is consistent. When I spoke with Dr. Brune and Ms. Levine of the Gwynn Center to prepare for today, they again also recognized that the data points are all over the place. And so having a group of people sit down and look through the extensive amount of studies to figure items out, just about what's getting in the way of us keeping the professionals, seem to be a priority for all of us. The second item I wanted to highlight is a personal story. I've heard from numerous friends as well as family members who, before the pandemic, were attempting to get in to see psychiatrists and other mental health professionals to get the necessary help. Some of my friends were literally waiting months, weeks, and this is for their children and other family members. We have to figure out a way to help each other when it comes to helping get this mental health diagnosis in a way. Actually, there's a Mental Health America does a 15-point study as to where exactly access to mental health professionals, affordability, and numerous other elements on this 15-point scale. For the last few years, Nevada has consistently ranked 51. I love my state. I love so many parts of it, but that number is not acceptable, and it is not acceptable for my friends and family and the other individuals who live in our state. We have to do better. As I stated before, the study is just to concentrate on the workforce development. How do we attract and also retain the professionals we need to be able to start to truly help each other? It's a workforce issue. It is not about looking at the pharmaceutical elements, which is another part of many other studies that has to do with mental health. It is not about the process. It is only about the career itself. I know that there's many other elements that I could talk about, but instead I wanted to actually hand it over to the individual who started this process. This bill was initially from a former Assembly member, Connie Monk, and she was working with Dr. Sarah Hunt of University of Nevada, Las Vegas, as well as Dr. John Packham of my alma mater, the University of Nevada in Reno. And so I'd like to hand it over with the chair's permission to a former Assembly member Monk to be able to continue to talk about.
Yes, please.
Thank you. Connie, would you like to continue?
Yes, and thank you. And thank you, Madam Chair and members of the committee. I appreciate the time and effort put into this. As you know, my name is Connie Monk. I'm a retired behavioral health professional. I've worked in Idaho, California, and Montana in the behavioral health field. I believe it's imperative that we improve our behavioral health status in Nevada. As Assemblywoman Anderson stated, we're 51st in the nation. And especially this last year due to COVID-19 and the negative impact that it's had on Nevada's population and the mental health. As we all know, there's a serious lack of services and providers in Nevada, and it has been glaring for years. A lot of it due to lack of funding in previous years, education, licensing requirements that take several months to license even a professional that's worked in another state coming here in Nevada. And of course, Medicaid, the low reimbursement for Medicaid. I believe by appointing an interim committee to study the behavioral health workforce, this committee can be with the community, evaluate existing behavioral health pipelines, and identify the efforts and opportunities to attract mental health, recruit and train mental health students and professionals. The committee can establish partnerships not only in the community but the state in higher education to increase the lack of treatment office options, of course, that we have here in Nevada. We need to identify the gaps in services. And most importantly, we need to identify the different types of behavioral health professionals and gaps we have, which are demand for the services. We maybe have a lot of mental health professionals, maybe a lot of social workers, but we don't have enough licensed alcohol and drug professionals that we need. And so by doing this interim committee, we can identify the various demands for services that doesn't match the supply of providers that we have here in Nevada. It would also consider methods to attract behavioral health students and professionals, train them and retain them, I think, which is really important here in the state. We do have 5 regional behavioral health policy boards. However, this committee would be unique in that the sole purpose would be to study the development of the workforce in Nevada, make recommendations, strategies, and policy options as stated above. I don't think we can continue to sweep mental health under the rug any longer. I ask that you please consider critical mental health workforce in Nevada. I thank you, Madam Chair, and I thank you, the committee, for your time.
Thank you, former Assemblymember Monk. May I hand it over now to Dr. Hunt of the University of Nevada, Las Vegas, who actually I believe is an individual who brought this forward, and I've had the opportunity to meet with her extensively on numerous issues. And unfortunately, or fortunately, whichever way you feel, it has made me rethink a little bit about the UNLV. And I have grown in respect for the school in the South because of our conversation. So if I may, hand it over to Dr. Hunt.
Please.
Dr. Hunt, would you like to continue?
Yes, thank you. Good afternoon, Chair Miller and members of the committee. My name is Sarah Hunt, and I am the director of the UNLV Mental and Behavioral Health Training Coalition. I will note that I am not representing UNLV as an institution in my remarks. I thank you for the opportunity to come before you today. I have studied Nevada's behavioral health workforce since 2015. Over the course of that time, I have attended a number of legislative, regional, and community meetings and forums where barriers to accessing mental health care across the state have been discussed. One issue that consistently comes up is Nevada does not have enough mental and behavioral health professionals to meet the growing needs of our communities. You will see in Dr. Packham's presentation that this shortage exists across the state and across multiple behavioral health disciplines. These significant shortages are not unique to Nevada. And other states are working to address recruitment and retention of behavioral health professionals in their states through multi-stakeholder approaches. As a state, there have been many initiatives in Nevada to improve and increase the healthcare workforce. However, few have focused solely on the behavioral health workforce. A study that explores the continuum of workforce development from promotion of behavioral health careers to education and training, to licensure, to employment, to insurance paneling, and all points in between, hopefully, would be a significant comprehensive step forward to provide better access to behavioral health care in our state. Finally, it is important to understand the impact of the current pandemic on the behavioral health workforce. The National Council for Behavioral Health released the results of a national study of behavioral health providers in September that indicates while a majority of providers saw an increased demand for behavioral health services during the pandemic, this industry also experienced layoffs, furloughs, and some reduction in revenue. Additionally, there was a substantial shift to providing behavioral health services to telehealth platforms. So an interim study would also be helpful to gauge how Nevada's behavioral health workforce has weathered the pandemic. And now I will turn it over to my colleague, Dr. John Packham, to provide data on our current workforce.
All right. All right. Good afternoon, Chair Miller and members of the committee. My name is John Packham. I'm Associate Dean in the Office of Statewide Initiatives at the University of Nevada, Reno School of Medicine. I'm also co-director of the Nevada Health Workforce Research Center, also based at the School of Medicine. I'm going to give you the shortest PowerPoint presentation I've ever made in my professional life. I've only got 3 slides because I think a greater analysis awaits if this resolution is passed, and really am thrilled that the attention is being drawn to workforce issues because just to echo what has been said before, you can have an insurance card in your back pocket. We can have reimbursement parity. We can have see a reduction in the stigma of mental illness and getting that mental illness treated. But if we don't have a workforce ready and able to provide those services, all of those efforts are moot. So the attention to health workforce is important. So a little bit of data. The map here is from a recently published report from my office, which is also one of the, I believe, meeting attachments that's been added to NALIS. It's the Nevada Rural and Frontier Health Data Book, which we just released this month. And this map highlights mental health workforce shortages. My maps tend to be color-coded so that the shaded areas are the ones in shortage. And this map just reveals essentially the entire state is a mental health professional shortage area, including all of Clark County and all 14 rural and frontier counties of the state. What that translates to is that close to 95% of our state's population reside in an area in which psychiatrists and other mental health professionals are in short supply. Also wanted to share a little bit of data, kind of a good news, bad news story on changes in the number of licensees in the state. And I've just arbitrarily picked 5. There's many other types of behavioral health workers in the state, but kind of a good news story is that we've seen growth in the number of licensees across most categories of health workers. However, and it's particularly acute in southern Nevada and Clark County, that growth is not necessarily kept pace with population growth. In areas of the state where we've seen population growth, Las Vegas and elsewhere, again, if you adjust for population growth, that increase has not been very great. And this is mirrored in other healthcare occupations. The final slide, and the one that I use more and more in presentations to discuss health workforce shortages are what it takes to be average. Now, I want to just state at the outset, I want us to be more aspirational than just being average. But this data is important in kind of highlighting what being ranked 49th or 50th in a given healthcare occupation means for the state. And for Nevada, what we've tried to do here is compare the number of health professionals to national metrics or national averages. So that, for example, in the case of psychiatry, we have statewide about 9 psychiatrists for every 100,000 residents of the state, whereas the national average is 15 psychiatrists. Likewise, for psychologists, clinical psychologists, that is, we have about 15 psychologists per every 100,000 population, whereas the national rate or average is about twice that amount. And what that means is, were to Nevada to rise to that national rate or national average, we would need close to 500 additional psychologists. We'd need close to or in the ballpark of 200 additional psychiatrists, and so on. Clinical professional counselors, I checked and double checked and triple checked that number. We'd need another 1,000 counselors. And again, to underscore what shortages mean is fewer providers per population, and in a state where I think we not only need to aspire to be average, given mental health needs that have been mentioned in testimony so far today, I think we need to move above that national average and so forth. So that data, again, was meant just to provide a real quick highlight of shortages in the state. If you would like additional information, feel free to reach out to me as this bill proceeds during the session. Also, feel free to take a look at some of the workforce information, again, that is contained in that data book. With that,
Thank you, Dr. Packham. Did I cut you off, Dr. Packham? Sorry about that.
it's all good.
So thank you, Dr. Packham, for that. Before kind of going over or being prepared for questions and everything, I'm not going to read to all of you the exact information and where the information should come from, but I did want to kind of explain why the people that are the non-voting individuals were being asked to be part of this task force, including the amended or the conceptual amendment. I think you all can figure out why it would be the public and behavioral health department being involved. And actually, I do want to clarify, I have not reached out to Dr. Whitley or a member of his department regarding this. And so want to make sure you all know that. And if they do call in, I had plans to contact them. It was my fault. I did not do so, and I will be doing so. But I think that one you totally understand, as well as the behavioral health professional. With the addition of the Nevada School Counseling Association, and that was in the conceptual amendment to clarify that it was the Nevada School Counseling Association. That is because, as an educator, I believe that we need to start talking about this profession earlier. We should not be waiting for students when they are in college to start thinking about entering this profession. It's a possibility for us to start talking about the need for it at an earlier level, and many of our counselors are aware of these items as well, whether it is social work or other areas. And so this way they can start coming up with possibly some ideas of how we can advertise and enhance what this profession does at an earlier age for our students. The second that is part of our conceptual amendment is a member of the insurance industry. That has nothing to do with workforce. I'm just going to, the development of it. But more than anything else, it has to do with the questions sometimes that arise when it comes to actually licensing people in this area. The insurance industry is an incredibly important part of our medical profession, whether it's mental health or physical health. And many times there are questions that, unless you are in the middle of the insurance industry, you're not always going to be able to understand. This would allow somebody who is from the insurance industry to be able to discuss why there should be some other classes being taken, or why there are some other elements that need to be discussed in a further stronger fashion. So that way, if we are successful in getting this to be an interim study, there's legislation that comes out of it, the insurance committees the insurance industry will already be aware of it and be a part of the solution. So we can truly have the necessary discussions during a time frame when we are not in a 120-day deadline. In closing, I would like to thank you all for this time, but also I would like to actually quote something from one of the studies. It's the 2015 HHS Behavioral Health Needs Meta-Analysis Summary from Nevada. Hope is the catalyst of the recovery process. That line, for whatever reason, really stood out for me. It is about hope. It is about helping people find that hope. But we have to have individuals that are in the profession that believe in getting the hope to others. And we need to figure out how to get this out there. Again, we've got to help our mental health illness patients. And the best way to do so is to have a strong workforce. Thank you so much for your consideration, and I look forward to our discussion today and also future. Thank you, Chair Miller.
Thank you, Assemblywoman. With that, I know you're open to questions, and we have a few members who have already requested some questions. So we will start with Assemblywoman Torres.
Thank you, Chair. Thank you, Assemblywoman, and to all the presenters. It's good to see familiar faces through the Zoom. I really do appreciate this piece of legislation and the effort that it has to study the workforce for behavioral health professionals in our state. Something I don't talk about is the fact that, my father growing up, he struggled with PTSD, and I guess he still continues to struggle with PTSD today as a survivor from the Salvadoran Civil War. And access to mental health professionals, behavioral health professionals has been difficult to come by in our community. And one of the gaps that we see are access to professionals that can help diverse speak languages. So if they prefer to communicate in Spanish or a different language, that has been one gap in access to care in our communities. And we additionally, we see it harder to come by access to these professionals in low income communities and communities of color. And what I don't see in this legislation right now, I do see I'm looking at page 3 of the legislation. I do see that we are collecting information related to demographics and geographic distribution, but I don't see that we're looking at identifying those issues, and then we're not considering methods of attracting professionals from diverse communities in the legislation as it stands. And I just think that would be a really great addition to this legislation. I've been working with a lot of our local mental health professionals throughout the state of Nevada, and I know that this has been a greater conversation of how we increase access to these professionals in diverse communities. And I think that the study really should help focus on some of those barriers that we have as well.
Through Chair Miller to Assemblymember Torres, agree.
Go direct.
And think about that, if I may. Sorry, Chair Miller, I just kept on going.
That's fine. Please just go direct.
Agree 100%, and did not even think about having that a separate section of how exactly are we, because mental health does not know. It does not know what community you're from, but the access and the ability to do the proper language, that is part of it. I feel like a little bit of it has to do with, and I keep on referring back to the Gwen Center report from 2014, because that's kind of what I use as my baseline for some things. And although it is a little bit mentioned in there, maybe we need to consider, I'm just thinking off the top of my head, of adding a little bit more to that, of making that a little bit clearer. However, I'm going to hand it over to Dr. Hunt and Dr. Packham, as well as Connie, to see if they have some other ideas as to why we don't have that in there at this time. But I'd be open to that amendment. Dr.
Hunt? Thank you for the question. Assemblymember Torres, you raise excellent points, and absolutely, I think that would be a great addition to this study, and is a necessary part of the study of our state and how we can best meet the needs of our communities, which are very diverse. And I would just note that in some other states, there are some unique opportunities to go out and do some recruitment into the behavioral health professions by going into those different diverse communities. And what I've seen before is they'll go into, especially like a high school setting, and do some presentations on just some general mental health topics. So here's what depression is. And then go into, if you like learning about that, did you know you could go into this, or this profession and stay within the state and do that? And then what I've seen after that is once those high school students kind of identify that they want to go into a mental health career and they get into the state higher education system, then there's a great mentoring piece that could also happen. So then you go into that community and find the mental health professionals and say, hey, would you mind being a mentor to students that are coming from your communities and want to study this? And act as kind of a support system, an anchor system, while that student then is going in through the higher education. And hopefully it also serves as a way to recruit that student then back into their community to practice and serve the members of their community. So I think it's a great recommendation for an addition.
Thank you. I appreciate that. And feel free to reach out so that we can work together on a possible amendment to this legislation. Thank you.
Okay, thank you. Our next question is from Assemblywoman Dickman.
Thank you, Chair. Am I unmuted? Thank you, Chair Miller. I thank you so much for giving me a chance to speak. And because I really just wanted to say how important this study is. It's so needed. And I love the fact that it focuses on behavioral workforce development. And so my question is actually for Assemblywoman Anderson, wondering if she would consider an amendment to let me be a sponsor of this bill.
Through Chair Miller to Assemblymember Dickman, I would be honored.
Thank you so
Very
much.
happy to do so.
Thank you.
Thank
And
you.
thanks for doing this.
Thank you.
Thank you, Assemblywoman. Our next question is from Assemblyman Levitt.
Thank you, Madam Chair. My question is just kind of logistic about the bill. So is this commission or is this commission seeking to find out where the gaps are, find out where we can find the where we need to include professionals? Because in your presentation, it sounds like you already have that information because you just presented it to us. Is there something deeper that we need to know as far as that goes? And is this commission going to do something beyond that? If you could just kind of go into maybe a little more detail.
Thank you for the question. Through Chair Miller to Assemblymember Levitt. Absolutely, we do have data, but we have so many different elements of data. What exactly is the issue here in Nevada? I think is the largest thing. And so that's what this commission or group is trying to do. Is the goal, would be to actually have some legislation proposed that if there are elements that are getting in the way of licensing, that we can clean that up. But the other element as well is to figure out ways that we can attract people to this profession. Is it the pay? Is it is it some of the torts? Is it other elements? And I think that Dr. Hunt touched upon it, as did Dr. I'm so sorry, I almost called him by his first name, Dr. Packham, with the Medicare reimbursement. Is that a process that we need to, as a state, look at the systems that we're using to try to get those elements in there? So you touched upon the exact problem. We have a ton of different items, but what do we do with the items? And so that's what this group would be doing, actually, is looking through some different data points that again are all over the place, but more importantly, what do we do with it next? Because I think that's probably one of the biggest problems, is that we all see that there's this huge elephant in the room that we all need to eat, and none of us know how to take that first bite. And so this is a way to start that process, is the main goal that I have for it. I didn't know if Dr. Hunt or if Dr. Packham or Ms. Monk wanted to add to that as well.
I could add, John Packham for the record. I would add that one of the things that this report could do is also trace the impact of some of the policy recommendations that were contained in that Gwynn Center report to see if over the last 8 to 10 years, they've had any difference on affecting the supply of health professionals, particularly in behavioral health. I think that the study could also take a look at recent measures undertaken by Governor Sisolak and others under the public health emergency. We've relaxed licensure, the ease in which an individual from another state can get licensed in Nevada over the past year. And what we've seen is a steady growth in the number of licensees in medicine, nursing, and so forth. And I think that this would be an opportunity for that study to assess whether those could address issues in the long term. Do we make some of those relaxation of licensure requirements permanent? If quality of care is not harmed and patient safety is maintained, maybe we need to take a look at some of those proposals again that are temporary until that emergency expires.
Thank you so much for that clarification. I just wanted you to tout a little bit of what the committee would do, and you gave me a very, very good answer. Thank you so much. Thank you, Madam Chair.
Thank you for the question. I forgot to do that right at the beginning. So thank you for the question, because I think it was a really important question to get out there. So thank you very much for that.
Thank you, Assemblyman. Next, we have a question by Assemblywoman Gonzalez.
Thank you so much, Madam Chair. Assemblywoman Gonzalez, Assembly District 16 for the record. Thank you so much for bringing this very important piece of legislation. I think I agree with a lot of what you and your presenter said about how important mental health is. I just had a question because it didn't really distinguish, or maybe I missed it or didn't read it. Is this classified, or will the study look at like private and public mental health as what, like professions? Like, will it include the private sector, and does the data that you provided include the private sector?
Thank you for the question, Assembly Member, and this is Assembly Member Anderson. You know, I don't think we ever did sit down and discuss whether it was public or private and where that information is coming from, because there is the use of the insurance agencies or the insurance individual, I'm sure would be bringing in some of that in the private companies, because I do think that that is a very large information. But as a quick follow-up, do you mean the data that we currently have, or do you mean where we're moving into?
Yeah, I guess both. Like, does the data that was, sorry, Assemblywoman Gonzalez, Assembly District 16, does the data that we have include both like public and private? And then in this study, will it distinguish between public and private mental health professionals? Is that like missing? Do we not know that information?
Thank you for the question, Assemblymember Gonzalez. I'm going to hand that over to Dr. Packham and Dr. Hunt. But I think that from what by the way, Assemblymember Anderson, from what I understand, I do believe it is both, but I'm going to let the two doctors be the ones to answer that question.
Sure, John Packham for the record. It would be inclusive of mental health professionals employed in all types of settings. Mental health is somewhat unique in that states and states in particular, I think state mental hospitals, for example, are key providers of behavioral health services. So to be comprehensive, you would want to look at the range of professions that practice in a range of settings, both inpatient and outpatient.
And this is Sarah Hunt for the record. I agree with Dr. Packham.
Thank you so much.
Thank you. Committee members, do we have any additional questions? Okay, not seeing any. I will ask a quick one, just a clarifying one. Assemblywoman, as the members are listed on, who the committee members would be, whom they would be appointed by at the beginning of the bill, I see that, I really appreciate that at least one of the committee members from the majority in each house will be someone on Health and Human Services, because I think that's important because they already have that background and experience and knowledge. And will also, of course, in the regular session, be there to kind of carry over the work done during the interim. I noticed it's not the same with our minority caucuses. And is that just because of the reduced numbers? We want to give the caucuses more flexibility to a point, or because if not, wouldn't the same thing be that we want a member with that same experience from HHS? So if you could just clarify that for, or if you have the answer for that.
Thank you, Chair Miller. Assembly Member Anderson, I believe it is because that there's only one from the two minority, from the one member from the minority leader of the Senate and one leader from the minority leader of the Assembly. However, I am more than happy to clarify that and say recommended that they be an individual from HHS, because I believe that there are many elements that sometimes getting dropped into this or jumping into this, into the deep end. Wow, there's a lot of things that unless you've been on this committee of HHS, you're lost. And so I'd be more than happy to add that it recommended that it be from the HHS. However, I believe it's because there's only one member appointed from those two areas.
Right. And for me, it's not, it's just, again, like you say, knowing that that's such a robust, topic. And then again, being able to be part of it to carry it through during the session. Okay, great. Members, any additional questions? Okay, seeing no questions, I would like to open it up to for testimonies of support. Broadcasting, if you could open the lines for those that wish to call in on ACR 5 in support. While broadcasting is opening the lines, I just want to remind everyone that everyone will have up to 2 minutes for their testimony. And of course, please remember to state and spell your full name before you speak. Broadcasting, whenever you're ready.
Chair Miller, I will queue up the first caller. Chair, what was the bill? Again, I just failed to write it down. I apologize.
No, not at all. ACR 5.
I was looking at my notes from Tuesday and I'm like, that's not the right thing. Thank you. Callers wishing to testify in support of ACR 5, please press *9 now to take your place in the queue. Caller with the last 3 digits, 656, please slowly state and spell your name for the record. You will have 2 minutes and may begin.
Hi, good afternoon, Chair and members of the committee. Will Craigman, representing Battleborn Progress. Today, we rise in support of ACR 5. With the extremely challenging year that all of us experience, access to mental health services is more vital than ever. This resolution to study the gaps in behavioral and mental health professionals available in Nevada is important to ensuring our state has adequate access to these services. We need to get to the bottom of why we are failing or why we are falling short in our state and make policy that improves Nevada's mental health workforce and system. I myself have recently begun going to therapy to start to help work through depression that I've struggled with for a long time and that intensified over this last tumultuous year. I'm lucky that I have health insurance and could find a great provider available in my network, but I know that that is not the case for everyone. I am already seeing the benefit of seeing a professional, and I want these services to be available to every Nevadan who needs them. Please support ACR 5 to study the disparities in services available and come up with solutions to our state's lack of available professionals. Thank you for your time.
Thank you.
Caller with the last 3 digits, 982, please slowly state and spell your name for the record. You will have 2 minutes and may begin.
This is Robin Reedy, R-E-E-D-Y. I'm the executive director of NAMI Nevada. That's the National Alliance on Mental Illness. And on behalf of NAMI, I would like to offer our support for ACR 5. The statistics that were mentioned earlier from Dr. Peckham is no surprise to anyone here, I'm sure. I've spent the past 3 years zooming around the state, whether in a car or on a teleconference services, and I've heard about the workforce shortage from every side of the equation. Various reasons are given by each area. Providers say it's Medicaid reimbursement. Educators and old-timers cite the lack of internships, and they both blame insurance for not treating mental health services with the same access for service as those issues above the neck. Many point the finger at various licensing boards dragging their feet on approving qualifications or providing reciprocity. Lastly, I have even heard of therapists being hired as social workers within the education system, and now providers can't find staff because we are so low on staff in those categories. The people of Nevada deserve the opportunity to experience health and productivity. In support of this goal, NAMI Nevada urges public policies based on data that ensure that all people have access to the right treatments at the right time. Thank you for bringing forth this bill.
Thank you.
Caller with the last 3 digits, 570. Please slowly state and spell your name for the record. You will have 2 minutes and may begin.
Thank you. Good afternoon, Chair Miller and members of the Assembly Committee on Legislative Operations and Elections. My name is Leah Case, Leacase, here today on behalf of the Nevada Psychiatric Association in support of ACR 5. We have submitted a letter in support which has been uploaded to Nellis, and just wanted to give our thanks on the record to Assemblywomen Anderson and Peters, as well as former Assemblywoman Monk for bringing this legislation. Also to Drs. Hunt and Peckham for their work in the behavioral health workforce shortage area. We urge your support and offer the members of the Nevada Psychiatric Association as a resource for this study. Thank you.
Thank you.
Caller with the last 3 digits, 577. Please slowly state and spell your name for the record. You will have 2 minutes and may begin.
Hi, my name is Genevieve Ramos. That's Genevieve, Ramos, Ramos. I am calling on behalf of myself. I am a licensed marriage and family therapist. I'm a licensed clinical alcohol and drug counselor. I am currently the clinical director at JC Lighthouse and JC Family Services. I ran as the director of operations at Serenity Mental Health for 8 years. I no longer work for them, so I'm not representing them at this time. However, during my time within that role, I definitely wanted to voice my support of the ACR 5 because I have so much experience in the field and representing at least 30 students, assisting them through the process of student practicum, internship, and licensure. Being in the mental health field for 12 years, I have lots of perspectives, both in the South and the North, starting in Las Vegas, where I began my practice, and moving up north to Reno and Carson City. I feel that the topics that were discussed and the statistics that were discussed in today's meeting were absolutely accurate in my experience. And my main goal, I guess, for this committee would not only be, of course, to identify the deficits, but to hopefully put together plans moving forward to increase the providership in the state of Nevada. And I also had just one question is, how can myself as just a regular Nevadan who works in the mental health field, how can I participate more and assist the committee, or even perhaps be a part of the committee in identifying the further needs or sharing more of my experience, my vast experience with this particular topic? Thank you so much.
Thank you.
Caller with the last 3 digits, 564. Please slowly state and spell your name for the record. You will have 2 minutes and may begin.
Good afternoon. Thank you. My name is Tom Durante, T-O-M-D-U-R-A-N-T-E. I am the president of the Nevada chapter of the National Association of Social Workers, and I chair the Committee on Rural Social Work. And I'm a licensed clinical social worker with over 30 years of experience working in behavioral health services in the state of Nevada. My experience has provided me with the opportunity to witness firsthand, and in a number of settings, the critical shortage of behavioral health care providers in our state. As noted earlier, the entire state of Nevada is considered to be experiencing shortages of behavioral health professionals. Also, as we heard earlier, Nevada ranks at the bottom of the states for access to mental health care and one of the highest rates of suicide. Although there are, of course, many factors contributing to these statistics, the workforce issue is a critical factor. These figures are bound to only worsen in the wake of the COVID and economic crisis we find ourselves in. A comprehensive behavioral health workforce study is crucial as we plan for our future. The contributing factors to our behavioral health care professional shortage are many, including salary issues, deprofessionalization, student debt issues, accessibility to higher education, and the lack of a pipeline from high school to college to the workforce. A study with a solid follow-up plan is needed. This is why I support ACR 5, and thank you much.
Thank you.
Caller with the last three digits, 263, please slowly state and spell your name for the record. You will have 2 minutes and may begin. Caller with the last three digits, 263, please press *6 to unmute.
Good afternoon, Chair Miller and members of the committee. This is Jesse Wadhams, Jessewahds, with the law firm of Black & Wadhams today on behalf of the Nevada Hospital Association. We are pleased to support ACR 5 in examining the behavioral health workforce in Nevada. Obviously, the understanding behavioral health and the workforce itself is a key component to all of Nevada's healthcare delivery system. And we thank Assemblymember Anderson for this bill and look forward to working with you in the interim. Thank you.
Thank you.
Caller with the last three digits, 100, please slowly state and spell your name for the record. You will have 2 minutes and may begin.
Hello, this is Steve Shell, S-H-E-L-L. I'm Vice President of Behavioral Health at Renown Health and Renown, and I'm also the President of the Board of Directors for NAMI Nevada, that is the statewide organization for the National Alliance on Mental Illness. Thank you for giving me the opportunity to speak to you today in support of ACR 5. In the last 10 years that I have lived in Nevada, I have opened the state's two newest behavioral health hospitals in Las Vegas and Reno that were built from the ground up to provide both inpatient and outpatient mental health and addiction programs for all ages. I have seen firsthand how Nevada is severely lacking in the number of mental health providers to sufficiently meet the mental health and addiction needs in our state. We simply do not have enough psychiatrists, psychologists, social workers, therapists, and particularly psychiatric nurses in the entire state to adequately care for our growing population. Many individuals who need medication management and/or talk therapy have to wait several weeks to be seen by a provider. There are also often patients in emergency rooms across the state waiting for extended periods to be transferred to behavioral health hospitals as there may not be available beds due to staffing shortages. Telehealth has certainly improved access to treatment for some people, but we are still in dire need of more providers in order to expand both telehealth and in-person services. Recruitment and retention of mental health professionals is more critical for Nevada than ever. We need to help our colleges and universities expand to accept more students for these professions, and we need to increase the promotion of these career options to attract individuals that are interested and passionate about working in the field. We have a large number of residents in our state that are not able to receive the treatment they need and deserve. I strongly urge that ACR 5 be passed so that we can continue to identify creative solutions for our state. Thank you for your time.
Thank you.
Chair, there are no more callers in support of ACR 5 at this time.
Okay, thank you. Can we open the lines for anyone in opposition?
Callers wishing to speak in opposition on ACR 5, please press star 9 now to take your place in the queue. Chair, there appears to be no one wishing to testify in opposition to ACR 5.
Okay. Do we have anyone who wishes to testify neutral?
Anyone wishing to testify in neutral on ACR 5, please press star 9 now to take your place in the queue. Caller with the last 3 digits, 927, please slowly state and spell your name for the record. You will have 2 minutes and may begin.
Hello, and thank you, Committee Chairwoman Miller and committee members. My name is Hava Ahmed, H-A-W-A-H-A-H-M-A-D, and I am here representing the Clark County Education Association. The Clark County Education Association engages in bipartisan advocacy for the advancement of public education in the state of Nevada. CCEA is testifying in neutral on ACR 5. CCEA would like to thank the sponsors of this bill for their efforts in addressing the shortage of behavioral health professionals in the state of Nevada. If the COVID-19 pandemic has shown us anything, it is that our lack of attention in the development of the workforce related to behavioral health has been alarmingly exacerbated and negatively impacting our students and has negatively impacted our students. With the formation of a legislative commission, issues relating to the development of the workforce for behavioral health professionals to improve access to behavioral health care in the state can finally be examined with a close lens. Specifically, the addition of a school counselor will help to ensure that we do not forget that the behavioral healthcare workforce in K-12 must also be examined, retained, and further developed to provide for more manageable student to specialist ratios to make their services more impactful. CCEA would like to request this committee and Assemblywoman Anderson to consider adding an additional position for a school social worker to ensure that the development of the behavioral health workforce includes individuals that understand how to create, implement, and follow an individualized education plan. In addition to a social worker from K through 12, we ask that this committee ensure that programs currently being implemented in school districts are included in the approach this commission takes to strengthening behavioral health professional development. Overall, we are very excited by this bill and look forward to supporting this legislative commission in any way possible to ensure that the behavioral health workforce is developed to help every Nevadan who needs it. Thank you to Assemblywoman Anderson and the sponsors of this bill.
Thank you.
Chair, there are no more callers to testify neutrally on ACR 5.
Okay, thank you. Well, with that, I would like to thank Assemblywoman Anderson for bringing forth this legislation, and of course, Dr. Hunt and Dr. Packman and former Assemblywoman Connie Monk for joining in to present this legislation as well. With that, I'd like to close the hearing on ACR 5 and move to our next agenda item, which is public comment. So we will give callers a moment to call in. And again, while we're doing that, just want to remind everyone that you will have 2 minutes to make public comment on something that is under the purview of this committee. And we will have up to 30 minutes of public comment. So broadcast whenever you have the first caller, please proceed.
To make public comment, please press star 9 now to take your place in the queue. If you would like to make public comment, please press star 9 now to take your place in the queue. Chair, the public comment line is open and working. However, we have no callers at this time.
Okay, let's just wait another moment to ensure we capture everyone who may be attempting to call in at this moment.
Okay.
Broadcasting, do we have anyone that has called in?
Chair, the public comment line is still open and working. However, we have no callers at this time.
Okay, thank you. Well, with that, we will close the item on public comment. Our next meeting will be posted and agendized when scheduled. With that, I will adjourn today's meeting. Thank you, everyone.